is that it's a PPAR delta agonist. It suppresses bile acid synthesis by reducing CYP7A1. So yes, CYP7A1, it reduces it, but it does that indirectly through FGF21. So your PPAR delta comes in, FGF21 goes up, FGF21 binds to a receptor, and then through this signaling pathway, it suppresses CYP7A1. Whereas with obeticholic acid, the bile acids come, and through SHP, they're inhibiting the CYP7A1 pathway. So let's look at elafibranor. Okay, as I said, you'll hear about fenofibrate, bezafibrate in a moment. This was a randomized controlled phase 3 clinical trial. Insufficient response to UDCA, 80 milligrams of an alpha delta versus placebo, 12-month endpoint, long-term extension. 51% of patients meet the regulatory definition of response, alk phos less than 1.67 versus only 4% of placebo. Looking at the ideal responses at 12 months, 15% of patients normalized their alkaline phosphatase. Looking at the patient perspective and itch, elafibranor in the primary analysis, the determined statistical plan, did not improve pruritus, but in secondary analyses does. Okay? So in the key secondary analysis, elafibranor, there's no difference between the pruritus between the patients who've got moderate to severe itch. Long-term data is now being presented, and this is from AASLD. You can see that the composite response stays high, 60s to 70s. The FibroScan appears to be stable with no progression, and there appears to be improvements in pruritus and fatigue, but of course the data becomes open label and there's no placebo to compare with. One of the biomarkers of itch is IL-31. In the elafibranor study, IL-31 does not go down, but other proteomic signatures do get better in patients who have a pruritus response. So we're starting to get better biomarkers of pruritus. Seladelpar, I told you, a delta agonist, dosed at 10 milligrams in a very similar phase 3 trial, has a 12-month endpoint, a 6 months for itch, and then an open label extension. It has a 61% biochemical response, but in this clinical trial there was a high placebo response. The normalization rate is 25% versus no one in placebo, and that's at 12 months. And then the pruritus data is cleaner. At 6 months, in those patients with moderate to severe pruritus, the pruritus is better in those patients receiving seladelpar versus placebo. So for this clinical trial and this agent, there was the ability to demonstrate the pruritus signal. The open label extensions are similar. This is from AASLD, 70% response, 33% normalization rate, and ongoing improvements in alk phos up to 3 years. The FibroScan data demonstrated for seladelpar both stability and signs of improvement. So it may well be that we're developing drugs now that will actually start to reverse liver fibrosis and cholestatic disease. Okay? Other symptoms got better, and this is the data over a longer period, 30 months, where itch is improving, and you can see that itch really is significantly improved by seladelpar. We have put together the drugs, okay? So we have put together obeticholic acid, urso, and bezafibrate. And when you combine the 3 drugs, we have significant improvements in alk phos normalization and remission. And we've done this in the patients with the highest risk disease. Finally, although there's a whole talk on itch, I will just mention linerixibat. It's an oral IBAT inhibitor. It stops the reabsorption of bile acids in your colon, so it gives you diarrhea. Bile acids do not return as much to the liver. The hepatocyte is starved of bile acids, so it sort of produces more to shunt somewhere else. But that means there's reduced bile acids in the serum, and that means you get less itchy. This was the clinical trial of linerixibat versus placebo, including a placebo-controlled component and a crossover. You can see that linerixibat improves pruritus more so than placebo. When a patient goes from placebo to drug, their itch gets better. When they go from drug to placebo, their itch gets worse. So with that, I think there's lots of information about PBC, and I've given you our perspective on what's happening in the West. Thank you very much.